Are you over 60? Have you recently noticed your legs getting weaker, difficulty maintaining balance, or feeling unsteady when walking? You might think it's just normal aging, but the real cause could be hiding in the bottle of vitamins you take every day. Many older adults, in an effort to stay healthy, are unknowingly misusing or overdosing on certain vitamins, leading to muscle, bone, and nerve imbalances, especially loss of lower limb strength. Direct hit in today's video, we'll break down with expert insight 3 vitamins that seem beneficial but, when misused, may silently destroy your leg strength. Crossmark 1. High-dose vitamin E, this silent leg weakener. Magnifying glass tilted left. What is vitamin E, and why do seniors often take it? Vitamin E is a fat-soluble antioxidant that protects cells from free radical damage. It's commonly advertised to slow down aging, improve vision, support heart and immune health. As a result, many older adults, especially women, routinely take vitamin E supplements, often in doses 2 to 5 times higher than the safe recommendation. Warning, but what happens when you take too much vitamin E? According to clinical studies and the Institute of Medicine, IOM, the maximum safe dose for adults is 400 IU/day. Going beyond this may cause serious side effects, particularly in seniors. Red triangle pointed down 1. Peripheral nerve damage. Excess vitamin E can damage the myelin sheath, slowing down nerve signals to the legs. Result: numbness, muscle weakness, balance issues, and higher risk of falls. Red triangle pointed down 2. Impaired muscle blood supply. Vitamin E acts as a natural blood thinner. In high doses, it may overly thin the blood, reducing oxygen delivery to muscle tissues. Older adults already have weakened circulation, resulting in tired, weak legs. Red triangle pointed down 3. Poor absorption of other fat-soluble vitamins. High doses of vitamin E can block the absorption of vitamins A, D, and K, essential for muscle, bone, and nerve function. Long-term result: loss of bone density, weaker muscles, and full-body fatigue. Pushpin warning: signs of vitamin E overdose in older adults. Tingling or needle-like sensation in arms or legs. Frequent imbalance or tripping while walking. Unusual fatigue after light activity. Easy bruising without obvious cause. Backhand index pointing right. If you're experiencing any of these symptoms and taking vitamin E supplements, stop and consult your doctor immediately. White heavy checkmark. Expert advice. How to use vitamin E safely. Never self-prescribe high doses, over 400 IU/day, without medical guidance. Prioritize natural sources of vitamin E, such as sunflower seeds, olive oil, almonds, avocados, and dark leafy greens. If supplementation is necessary, opt for 100 to 200 IU/day and monitor with regular checkups. Direct hit expert conclusion. Vitamin E isn't the enemy, but used incorrectly, it can attack your legs first. As we age, we must be twice as cautious about what we put into our bodies. The body's ability to eliminate excess slows down, and even small mistakes can lead to major declines in mobility and quality of life. Crossmark 2. High-dose vitamin B6, the motor nerve destroyer. Magnifying glass tilted left. What is vitamin B6, and why do seniors often take it? Vitamin B6, pyridoxine, is a water-soluble vitamin essential for healthy nerve function, protein and energy metabolism, production of neurotransmitters like serotonin, dopamine, and GABA. Older adults frequently take B6 supplements to support memory, relieve nerve pain, combat fatigue, and symptoms of depression. However, here's a surprising and little-known truth. Taking high doses of vitamin B6 can silently damage your nervous system, especially in your legs. Warning: too much of a good thing becomes harmful. Bar chart. What's the safe limit? According to the Institute of Medicine, IOM, the maximum safe dose for adults is 100 milligrams per day. But in reality, many seniors unintentionally exceed this through multivitamins, nerve support supplements, or over-the-counter brain boosters, without even realizing it. Some supplements contain 50 to 200 milligrams of B6 per dose, and taking such doses for more than 2 months poses a serious risk of nerve toxicity. Warning: what happens when you overdose on vitamin B6? Crossmark 1. Peripheral nerve damage. When B6 accumulates in the body, it causes inflammation and damage to long nerve fibers, especially those in the legs. Common symptoms include tingling, prickling, or pins and needles in the feet, numbness in the toes, weakness in the lower limbs, and unsteady walking. A strange feeling that your legs are not part of you. Warning: this nerve damage can become permanent if left untreated. Crossmark 2. Loss of reflexes and motor coordination. Excessive B6 directly affects both sensory and motor nerves, leading to reduced ankle reflexes, poor hand-foot coordination, increased risk of falling, a leading cause of serious injury and death in seniors. Pushpin warning signs to watch if you're taking B6 supplements. Using B6 or nerve tonic supplements for more than 2 months. Nighttime tingling or burning in your feet. Trouble balancing with your eyes closed. Diminished ability to sense heat or cold in your feet. Legs feel like jelly when walking. White heavy checkmark expert advice. Reassess your dose and duration. Never self-prescribe high-dose B6 above 50 milligrams per day without consulting a neurologist. Natural food sources remain the safest and most effective. Salmon, bananas, chicken, sweet potatoes, oats. If high doses are needed for nerve pain, the treatment should be short-term and closely monitored by a medical professional. Direct hit expert conclusion. Vitamin B6 is a double-edged sword. At the right dose, it's a healer. At the wrong dose, it's a neurotoxin. Older adults, especially those with muscle weakness, frequent falls, or diabetic neuropathy, must be extremely cautious with nerve support supplements. Always read the label, understand the dose, and talk to your doctor before use. 3. High-dose vitamin D, the double-edged sword that weakens your muscles. Magnifying glass tilted left. Why do seniors often take vitamin D? Vitamin D plays a vital role in absorbing calcium to strengthen bones, supporting immune health, protecting the neuromuscular system. For older adults, vitamin D deficiency is common due to limited sun exposure, poor absorption in the digestive tract, declining liver and kidney function. That's why many seniors turn to high-dose supplements, sometimes taking 5,000 to 10,000 IU per day, 5 to 10 times the recommended amount. Warning: the hidden dangers of excess vitamin D. Few people realize that too much vitamin D is actually a major contributor to leg muscle weakness, loss of balance, increased fall risk in the elderly. Crossmark 1. Calcium metabolism disruption. High doses of vitamin D cause excessive calcium absorption, leading to hypercalcemia, high blood calcium, calcium deposits in soft tissues, including muscles and nerves. Typical symptoms include muscle fatigue, especially in the thighs and calves, feeling exhausted after walking a short distance, unexplained muscle stiffness or pain. Crossmark 2. Electrolyte imbalance, the silent muscle killer. Excess vitamin D can deplete magnesium and potassium, two minerals crucial for nerve-to-muscle communication, muscle strength, and elasticity. This results in frequent muscle cramps, poor coordination, reduced leg strength and balance. Crossmark 3. Kidney strain, disrupting the body's mineral balance. Prolonged high-dose vitamin D burdens the kidneys, reducing their ability to regulate calcium and phosphate levels. The result: widespread muscle weakness and fatigue. Pushpin warning signs that vitamin D is backfiring on you. Unexplained fatigue or muscle aches, especially in the legs. Difficulty walking or maintaining balance. High blood calcium levels on lab tests. History of kidney stones or chronic kidney disease. White heavy checkmark expert advice. Treat vitamin D like medicine, not candy. Never exceed 4,000 IU/day without medical supervision. Get regular blood tests to monitor 25 OH, D, calcium, and kidney function. Use safe maintenance doses, 800 to 2,000 IU/day. Combine with magnesium, vitamin K2, and proper hydration for safe metabolism. Direct hit expert conclusion. Vitamin D can help you stay upright, or it can bring you to your knees. It all depends on how you use it. Don't let the promise of stronger bones blind you to the truth. Any fat-soluble vitamin, when overused, can act like a toxin, especially for people over 65 whose bodies are less efficient at balancing internal chemistry. Caution is not optional. It's essential. Warning expert summary. 3 vitamins you must reevaluate if you're experiencing leg weakness. Crossmark high-dose vitamin E disrupts nerve signals and reduces oxygen to muscles. Crossmark high-dose vitamin B6 can cause irreversible nerve damage. Crossmark high-dose vitamin D leads to muscle loss, imbalance, and fall risk. Key remember, vitamins are double-edged swords. You don't want to be deficient, but overdosing is just as dangerous. For seniors, excess vitamins, especially fat-soluble ones, can trigger severe side effects. Brain, let vitamins support you, not silently weaken you. White heavy checkmark, always check the label and dosage. White heavy checkmark, follow your doctor's guidance. White heavy checkmark, and most importantly, strong legs don't come from pills, but from balance, movement, and truly understanding your body.